So now we shall be discussing regarding the arches of the foot. Okay. So our topic of discussion will be regarding the arches of the foot. So basically in the foot region we have got two important arches. Okay. For example, see, this is how the foot is located, right? So foot is not flat basically. Foot is a curved part like this, right? So if you see, this is an arch. You see an arch here, you see an arch here, on both the sides you see an arch, right? So these are called as the arches of the foot. And now why the foot should have such presentation? Why should it be arched? The reason is that foot basically has got two functions. Okay, the first function is that, see, when you are standing, right, the entire weight is impended upon the foot. So what does the foot do? The foot will bear your weight, right? It will support the weight of the body. And second important thing the foot does is that this foot acts as a lever for walking, for running, as well as for jumping. Okay, for example, if the foot is flat like this, right, then it will be very difficult for you to walk, to run, or to jump. Okay, and if the foot is flat, if you are standing for a long time, there will be a severe pain in the entire length of the foot. Okay, so for these reasons the foot is arched in this way, so that whenever a weight is impended upon the foot, what will happen is that this arch will flatten and again it will come back to its original position like a spring. Okay, for example, if this is the floor and this is the foot is on the floor right now, right? If you are putting a pressure, what is going to happen? What is going to happen is that the foot will stretch like this and again it will regain to its normal position. Okay, so the weight whatever is there, of the weight of your body, is spreading in bidirectional way. So here as well as here, anteriorly as well as posteriorly, right? So whenever you are resting your foot on the floor, there are 3 points in the foot which touches the floor. Okay, so these are called as weight bearing points. So let us see what are those weight bearing points. But before that, first of all, we shall look what are the functions of the foot and why these arches are necessary. So just for your notes point of view, I'm just writing it, not for your exam point of view. So foot has got two functions. The first is it supports the body weight. It supports the body weight. And second important thing is it acts as a lever. It acts as a lever for walking, running, as well as jumping. Walking, running, as well as jumping, right? So if the foot is flat, then walking, running, jumping and all these things would be highly impossible, right? So such kind of foot you call it as flat foot, right? So let us see where are the weight bearing areas. And by the way, remember one thing, that when the foot is like this, it is acting like a spring, right? So it is acting like a spring in this way. So it becomes flat, it comes back to its normal position, becomes bad, again regains back to its normal position. So it is acting like a spring, right? So let us see what are the weight bearing points of the foot. So if you look at this foot, just logically you think whenever you are resting the foot on your floor, right? So what are the main weight bearing points where the foot touches to the floor, guys? See this one, this point, and even this region, and even the heel region also. These are the 3 points, right? So what is this region called as? This region we have got metatarsals. So the head of the first metatarsal, next here also the head of, not first, head of the fifth metatarsal, head of the fifth metatarsal, right? And next important thing is that this is the calcaneum. So these are the 3 weight bearing areas rather, right, which you need to know. These are called as the weight bearing points. Weight bearing points of the foot, or rather you can call it as a sole. Okay, weight bearing points of the sole or weight bearing points of the foot. So in the foot, as I already told you, foot is arched. So there are 2 arches. So these 2 arches are called as longitudinal arches. So one arch is located medially, this is called as medial longitudinal arch. One arch is located laterally, this is called as a lateral longitudinal arch. For example, look at this picture over here. So you can see an arch like this, right? So this arch is called as a medial longitudinal arch. In the same way, you can also see an arch here. This arch is called as a lateral longitudinal arch. Medial longitudinal arch, right? And this one is called as a lateral longitudinal arch. So we have got two arches, medial longitudinal and lateral longitudinal. Now we shall discuss in detail about all the medial as well as lateral longitudinal arches. Okay. So first important thing is that we shall focus on medial longitudinal arch. Medial longitudinal arch. So any arch it might be, either it might be medial or lateral. There is one basic picture which you need to remember, right? So what is this basic picture is that, let us say for example, this is an arch like this. Okay, to understand this concept better, so this is the picture which you need to know. This is an arch. Now in this arch, if you see, right, so there are some stones over here. Let us say there are some random stones over here. In this way we have got stones, right? So let us see how many number of stones are located here. 1 2 3 4 5 6 7 as well as 8 stones are located. So all these 8 stones together are forming an arch. Now if these 8 stones should be like an arch itself, right? So see, these 8 stones are located like this, like an arch, right? So these 8 stones should not separate from each other. They should stay like an arch. If they have to stay like an arch, first of all these stones should be interconnected with each other. Yes or no? So these stones have to be interconnected like this with each other. So these interconnections are also called as intersegmental ties. So what are these called? These interconnections between the two bones are called intersegmental ties. Okay. So just compare these with the tarsals which are located. So here, I mean in the lower limb, I'm talking about lower limb. In the lower limb, you have got all the tarsal bones, right? You have got tarsals, you have got metatarsals, you have got phalanges. So all of them together are forming an arch. Now if this arch should be like an arch, right, to take a shape of an arch, first of all these bones should be interconnected with each other. So they are interconnected with each other with the help of ligaments. Those ligaments are nothing but here they are called as intersegmental ties, right? So for any arch, the important things you need to have is, one is intersegmental ties. Okay. Next important thing, out of all these bones, can you tell me which is the main bone here? What I will tell is that bone number 5 is the main bone. Why bone number 5 is the main bone? See, for example, if I am removing bone number 1, nothing is going to happen. Bone number 2 will take the place of bone number 1 and again the arch will be there. For example, if I am going to remove bone number 8, bone number 7 will come to bone number 8 position and again the arch might be small but there will be an arch. But if I remove this bone number 5, do you think an arch will be still like an shape of an arch? Do you think this will be similar to the shape of an arch? No, right? So this entire arch will disrupt. So bone number 5 is a very, very important bone here. That is why bone number 5 is called a keystone bone. Okay. So from now onwards, whether it might be medial longitudinal arch or lateral longitudinal arch, in both the arches there will be one bone in the center which is called as a keystone bone. Okay. So here bone number 5 is a keystone bone. Bone number 5 is a keystone bone. Second important thing is that if this arch should be in this shape like an arch, right? Another important thing is that, see, there are chances that this arch can become flat. So even if it goes flat, again it should come back to its normal position. It means there should be something in the bottom that is pulling the arch back to the normal position, right? So it means from bone number 1 to bone number 8, I have to attach some thing which is flexible and rubber like thing, right? So that this rubber like thing, even if the foot goes flat, right, what will happen? This rubber like thing which is attached near bone number 8 to bone number 1, this will pull back. When it is pulling back, again the arch is forming back. You're getting it, right? So these rubber like thing which is located in the below the plantar region, this is called as tie beams. Okay, these are called tie beams. So these might be muscles or these might be your aponeurosis, whatever it might be, these are called as tie beams. Okay, and second important thing is that if an arch has to maintain, one thing is you have to pull this anterior, see in this arch, this is called anterior pillar, this is called posterior pillar. So you are pulling the anterior pillar like this, that is the reason why arch is formed. Additional support, if I do like this, for example, additionally if I am putting a sling, what do you mean by sling? Sling is, let us say, a rope that is taken from above downwards in this way, right? So for example, if I am taking a sling like this, this is called as a sling. Now what I will do with this sling, I will pull this sling upward. When I am pulling this sling upward, this elevation you see here, when I am pulling this sling upward, this elevation, if I am releasing the sling, what will happen? The elevation is reduced. You're getting it? So this gives an additional support to make an arch. So what I'm trying to tell is that from here I am attaching a sling all the way down like this, right? So with this sling I'm lifting up the arch so that an shape of arch is perfectly formed. So these are called as slings. Okay, so in a real body, instead of this sling, there might be, in the place of this sling, there might be a tendon, there might be a muscle. Okay, so these are the things. So what are the things we discussed, guys? In any kind of arch, we need to have few important things. The first important thing we discussed was intersegmental ties. Okay, the second important thing we discussed was tie beams. The second important thing we discussed was tie beams. So if someone is asking you what is the function of tie beams, you have to tell that these tie beams prevent the separation of pillars. So this is anterior, that is posterior. So anterior, posterior, they don't get separated. So they prevent separation of pillars. Okay. Next, third important thing we have got is slings. And fourth important thing we have got is pillars, as I told you. How many pillars do we have? We have got 2 pillars. For example, here, when I tell 2 pillars, anterior pillar and posterior pillar, jo samne hai, that is anterior, which is back, it is called posterior. So here, what is the anterior and posterior pillar? I'll say that bone number 1 is anterior pillar, bone number 8 is a posterior pillar. Okay. So pillars, for example, just for an example, bone number 1 and bone number 8. Okay. So this is your anterior pillar and this is your posterior pillar. Clear? Now, the same thing I wanted to show in this particular part. So this is an arch, right? This is an arch. Now, in this arch, you can see 2 things. This one which you can see here, this is called lateral longitudinal arch, and this one which is towards me is called as a medial longitudinal arch, right? For example, let us say now I am putting a weight on my foot. Okay, I'm putting a weight on my foot. When I'm putting a weight on my foot, or let us say I'm jumping. See, when I'm jumping like this, what will happen? My arch will become flat like this, right? Now, after jumping, what will happen again? When I'm lifting my leg, what will happen? The tie beams, whatever are there, they are pulling these 2 anterior and posterior pillars together. Again, an arch is formed, right? So, I am stretching the arch. Now I am releasing it. When I am releasing it, you see, again the arch has been formed. It came back to its normal position, right? So this thing which I have kept it here, this is called tie beams. Additional to this tie beams, another thing what I will do is that I will put a sling like this. So this one, whatever you see here, this is called as a sling. Okay, so you see the sling here. Now I am pulling the sling, you see an arch that is formed. So let us put it like this. See, I am pulling the sling, you see an arch that is formed here. Right, so sling also gives an additional support here. So these slings can be muscles or these slings can be tendons. Okay, in the same way, these beams, whatever are there, these are called tie beams. So these tie beams can be again muscles or let us say aponeurosis. Mostly it will be aponeurosis and muscles. Okay, So next important thing is that here after the slings, next important thing is that this pole which you can see here is an anterior pole, this pole is a posterior pole. Okay, so the same part, now what we shall be doing is we shall draw the same part over here. Okay, right. So first what we shall discuss is the medial longitudinal arch. In the medial longitudinal arch, let me draw the bones now. Okay, right. Now here, first of all, let me put the shape of an arch and then draw the bones over here. Okay, so here you know that these are your metatarsals, right? So this is your first metatarsal, this is your second metatarsal, this is your third metatarsal. These are the three metatarsals. Just behind your metatarsals, you have got cuneiform bones. Okay, so let us say this is your medial cuneiform bone, this is your lateral cuneiform bone, and this one is your intermediate cuneiform bone. Okay, exactly uske piche we have got a bone called as navicular bone. This is your navicular bone, and uske baad we have got another bone here. This is called as your talus. This is called as your talus. Okay, now after the talus, here whatever bone you have is your calcaneus. This is your calcaneus. Okay, so look here now, this one C stands for calcaneus, and here T stands for talus, and here N stands for navicular bone, and within these cuneiform bones we have got lateral, we have got medial, we have got intermediate. And after that, this is the first metatarsal, second metatarsal, and third metatarsal. So let us, all of you know that this will be the anterior, this will be the posterior. Now this arch, whatever is formed here, this arch is called as a medial longitudinal arch. Okay, this is your medial longitudinal arch over here. So now in this, we have to basically discuss three important things. What are those three important things? What are the pillars here? Second important thing, what is a summit? Summit matlab मैंने बोला था ना, I already told you that there should be a keystone bone. So that is called as a summit. And third important thing is a summit. Summit is a keystone bone which is present in the center, right? And finally, let us see what are the joints that are located here, right? Now here, this is the thing I was telling you. This is the arch over here, right? So as I already told you, this arch which you are seeing from the lateral side is a lateral longitudinal arch, and this which is towards me is called as a medial longitudinal arch. What did I tell you? I told you that there is a bone that is located here, and this is called as a keystone bone. So we have got the pillars, we have got the summit, as well as we have got the joints. Okay. Now let us discuss what are the pillars here. Now in these pillars, you can find few important things. The first important thing is that we have got two pillars, anterior and posterior, right? So what is an anterior pillar and what is a posterior pillar? Okay, so this anterior as well as posterior pillar. Now anterior pillar is nothing but it is, what is this anterior pillar? Tell me. So in this, anterior pillar is formed by 1, 2, 3 metatarsals, right? So exactly speaking, which part of the metatarsal? The head, right? So 1, 2, 3, the heads of all the three metatarsals. Okay, so it is formed by the heads of first, second, and the third metatarsals. Okay, now after that, what is a posterior pillar formed by? All of you know, posteriorly we have got a bone called as calcaneum, right? So exactly speaking, the medial half. Why are you telling it as medial half? Because we are discussing the medial longitudinal arch, right? So we have to write it as medial half of calcaneum. Okay, medial half of calcaneum. This forms the posterior pillar. Now after, once the pillars are discussed, now we shall discuss the summit. Now when I will explain this summit, again I will draw the same picture which I drew before. right? So this is one bone, second bone, third bone, fourth, fifth, as well as sixth, right? Now in this you will tell me where is the summit of the keystone bone. The bone which is located exactly in the center is called as a keystone bone, right? Now this bone is very important. Why? Because, okay, let me write it down, that first of all this is a keystone bone, right? Now why this keystone bone is very important? Because I told you that if this keystone bone is lost, then the entire arch is lost. So let me prove that now. So for example, here in this you can see that this is an arch, and this center part, just imagine it as a keystone bone, right? Now what I will be doing is I am cutting this keystone bone like this, right? Now what I have done, I have removed this keystone bone. Now when I remove this keystone bone, you see this was, the arch is completely gone. This was the keystone bone which is located. Now the arch is now completely collapsed. You are getting it? So this arch is completely now collapsed. So keystone bone is very important over here, right? Second important thing, after the pillars as well as the summit, we have to discuss something called as joints, right? So let us see what are the joints that are located here. So before I discuss the joint, let me put up the picture again. So let me put this in a complete black. So this is an arch, this is a medial longitudinal arch, and here this is second and this is third. Now you are the guys who will be repeating what are these bones over here. So here we have got a cuneiform bone. What is this? Medial. This will be intermediate and that will be lateral, right? And here we have got a bone, this is called as navicular bone. And after the navicular bone, here you have got another bone like this. What will be this? This is called as your talus bone. Okay, this is your talus. So talus के बाद क्या होगा? What will be after the talus? After the talus you have got another bone. This is called as calcaneal bone, right? Now let us look at the ligaments that are located. So first important thing is this one, the heads as well as the medial part of the calcaneum, anterior posterior pillar हो गया. Next we have to discuss about the sling now, right? So the first important sling here is that from the calcaneus all the way you have got a muscle that is attached like this. Okay, so this muscle is acting as a tie beam, right? Now this muscle is called as abductor hallucis. What is this muscle called as? This is called as abductor hallucis. So from now onwards, if I ask you in medial longitudinal arch, what is the tie beam formed of? Tie beam is formed of abductor hallucis. Second important thing, not only abductor hallucis, just beneath here we discussed plantar aponeurosis, the central part which is very thick, right? So this one over here, he is called as your plantar aponeurosis. Second important thing, after the tie beams, once the tie beams are done, the next important thing is intersegmental ties, है ना? So what are these intersegmental ties? Between the bones, whatever ligaments we have got, these are called as interosseous ligaments. Yes or no? So these ligaments, whatever we are having, these are called as intersegmental ties. Okay, or you can also call them as intersegmental ligaments. Intersegmental ligaments. Second important thing is that regarding the joint, right? So the most important joint that is located here between your calcaneum, talus as well as navicular bone. So all of you look now. So this is a joint. Talus, navicular bone as well as calcaneum. So this joint is called as talocalcaneonavicular joint. So this joint over here is called as talocalcaneonavicular. This joint is called as 𝗠𝐞𝐝 joint. And second important thing is that, for example, if we put a spring over here, okay, so what I'm trying to tell you is that if this is an arch, right, see, from here till here, if you put a spring, so that even when the arch is stretching like this spring, when it will contract, the arch will come back to its normal position, right? So we will also put a ligament all the way from the navicular till the calcaneal bone, and this ligament is acting like a spring, so you call it as spring ligament, or exactly speaking you can also call it as calcaneonavicular ligament. Okay, spring ligament or calcaneonavicular ligament. So this one over here is spring ligament or calcaneonavicular ligament. Okay, so this is called as your spring ligament or calcaneonavicular ligament, right? So now we understood each and everything. We discussed what are intersegmental ties in medial longitudinal arch, what are tie beams in medial longitudinal arch, what are the pillars also we discussed. Now we shall discuss what are the slings here, right? So regarding the slings, let me put up this same picture over here, okay? Right, so regarding the slings, from here you have got a tendon. But before that, let me put up this bone over here. So from here you have got a tendon that goes all the way up like this. So this is acting as a sling. So this is called as tendon of flexor hallucis longus. Flexor hallucis longus. This is a tendon of flexor hallucis longus. Second important thing is that you have got a tendon that is going all the way anterior to tibia like this, and there is one tendon that is going all the way posterior to tibia in this way, right? So which is going anterior to tibia, this one is called anterior tibial muscle, tibialis anterior. Which is going on the back of the tibia is called tibialis posterior. So here you have got tibialis anterior, right, and this is called as tibialis posterior. So we have got tibialis posterior and we have got tibialis anterior over here, right? So these are some of the important things you need to know. So overall we shall make the differences between both of them later on. So now these are all the things which you need to know regarding the medial longitudinal arch. So in the medial longitudinal arch, we have to discuss about what are the intersegmental ties, tie beams, slings and pillars, right? So in the pillars, anterior and posterior pillar. Anterior pillar is formed by the head of 1, 2, 3 metatarsals. Posterior pillar is formed by the medial part or medial half of calcaneum. ठीक है, उसके बाद समिट मतलब यहाँ पे जो बीच में जो बोन है, that is called as summit. For example, so what is the keystone bone here? Tell me, what is the bone which is centrally located? So obviously the keystone bone here which I will tell is your talus, right? If talus is removed, then the entire arch is gone. So talus is the keystone bone. So I forgot to write previously, sorry, this is a talus which is the keystone bone. Okay, next important thing is joints. So regarding the joints, what are the important things we discussed? Between the bones, interosseous ligaments, right? So these are also called as intersegmental ligaments. Next we have got a joint here. This is called between the talus, calcaneus and the navicular. This is 𝗠𝐞𝐝 joint. And next we can also have a spring here. The spring is located between the navicular as well as calcaneus, and this is called as a spring ligament or calcaneonavicular ligament. And next we have got slings. One is in front of tibia, tibialis anterior, back of tibia, tibialis posterior, and next important sling is tendon of flexor hallucis longus. Okay, so this is all the discussion about the medial longitudinal arch. Now we shall focus on the lateral longitudinal arch. In lateral longitudinal arch also we shall discuss the same thing, then we shall make the differences between both of them. Lateral longitudinal arch. So in the lateral longitudinal arch, so let us say that let me make out an arch over here first of all, right? So here you have got your calcaneus. This one is your calcaneus. and after this you have got this part over here. This is your cuboid bone, and after the cuboid bone here you have got this metatarsal. This is called as the fifth, because lateral, right? Fifth metatarsal. And उसके बाद यहाँ पे जो metatarsal है, the metatarsal which is located here, this is called as your fourth metatarsal, fifth and fourth metatarsal. And obviously you have got your phalange all the way like this, right? So remember that this one is your fifth metatarsal, this is your fourth metatarsal, and this bone in the center is called as your cuboid bone. And obviously all of you know this is calcaneum. So this arch which you can see here, this is called as a lateral longitudinal arch. So first thing we discuss always is the pillars, right? So what are the pillars here? What are the pillars which are located here? So again the same thing, this is the posterior pillar here and this is the anterior pillar. So anterior pillar is formed by the heads of the lateral two metatarsals. Lateral two matlab fourth and fifth metatarsal. This is the anterior pillar. And next now the posterior pillar is formed by lateral half of calcaneum. In medial longitudinal arch the posterior pillar is formed by medial half of calcaneum क्योंकि वो medial longitudinal arch है. And this is lateral longitudinal arch, so it should be lateral half of calcaneum. Okay, so there are two pillars over here. One is called as anterior pillar, okay, and the next one is called as posterior pillar. Okay, so anterior as well as a posterior pillar. So here anterior pillar is formed by heads of two lateral metatarsals, and posterior pillar is formed by the lateral half or lateral tubercle of calcaneum. Okay, now after the pillar, next the summit. Now you will tell me which is the most important bone, the keystone bone here. So I think the keystone bone here which looks is the cuboid bone, right? So if you look at the summit, in the summit the keystone bone here will be your cuboid. Cuboid is a keystone bone, right? So that is a keystone bone. And when it comes to keystone bone, and next important thing, there are two important ligaments which you need to know. So all of you look here. So this is one ligament and this is another ligament. So both of them are looking similar. So both of them are also located on the dorsal or on the plantar side. Obviously they are on the plantar side. One is short, one is long. So one is called as short plantar ligament, another one is called as long plantar ligament. Okay, so this one over here is your short plantar ligament, okay, and this one over here is your long plantar ligament. So short plantar ligament, and the other one over here you have is your long plantar ligament. Right, now what we shall do is that we shall make out the differences between the anterior arch as well as the posterior arch. Okay, so there we'll discuss the remaining important things. So now let us make the differences between the medial longitudinal arch as well as the lateral longitudinal arch. Okay, so first we shall make out the difference between medial longitudinal arch as well as the lateral longitudinal arch. Okay, so medial as well as the lateral longitudinal arch. So the first thing we shall discuss here is that the first thing is the anterior end or anterior pillar. Okay, let us write it as anterior pillar. So anterior pillar is formed by, so in the medial longitudinal arch, what is the anterior pillar formed by? The anterior pillar here is formed by head of how many metatarsals? Head of the first, head of the second, and head of the third metatarsal. Okay, and in lateral longitudinal the anterior, yes, in the lateral longitudinal the anterior pillar is formed by head of fourth and fifth metatarsal. head of fourth and fifth metatarsal. Okay, fourth and fifth metatarsal. Now after the anterior pillar, the next one we shall be discussing is a posterior pillar. Okay, so here the posterior pillar is formed by the medial half or medial tubercle of calcaneum. Medial tubercle of calcaneum, whereas here it is formed by lateral tubercle of calcaneum. Lateral tubercle of calcaneum, right? Now after that the next important thing is that number of bones that are forming the medial longitudinal arch and number of bones that are forming the lateral longitudinal arch. So number of bones that are forming the medial longitudinal arch, the number of bones here are 9. Okay, the number of bones here are 9 and the number of bones here formed are 4. Now how is that? Now all of you look here. So this is the medial longitudinal arch. Now just count the bones. So here there are 3 bones, 3 plus and 3 cuneiforms also, and 4, 5, 6. Navicular is 7, talus is 8 and calcaneus is 9. So how many bones total? 9 bones, right? So 3 metatarsals, first, second, third, medial cuneiform, intermediate cuneiform, lateral cuneiform, again 3, navicular 1, talus 1 and calcaneus 1. So there are 9 bones which are forming an arch. But when it comes to the lateral longitudinal arch, see, calcaneus is 1 bone, cuboid is 1 bone, and 4th and 5th metatarsals are 2 bones. So how many? 4 bones are forming the lateral longitudinal arch over here, right? So 4 bones are forming this. Now after this, the next important thing is that let us look at the summit. Summit is what? The keystone part, right? So summit in case of medial longitudinal arch will be your talus, and summit in case of the lateral longitudinal arch will be your cuboid, cuboidal bone, right? And next important thing is that regarding the joint which you have here, joint. So all of you know that the joint which we have in case of medial longitudinal arch is between talus, calcaneus as well as navicular. Calcaneonavicular bone joint, right? So that is calcaneonavicular joint. And when I was discussing the topic of joints, I already told you that this calcaneonavicular joint is a type of ball and socket joint. Right? Now when it comes to the joint in case of the lateral, the joint here which I already told is between the calcaneus and cuboid, right? So let me show this, between the calcaneus and the cuboid. So the joint between calcaneus and cuboid is calcaneocuboidal joint. Okay, so that is calcaneocuboidal joint. Calcaneocuboidal joint, and remember that this is a saddle joint. This is a saddle joint. So calcaneocuboidal joint, let me draw it again. So see here, the joint here between the calcaneus and cuboid. Now don't think of short plantar ligament, long plantar ligament. They are not joints, they are different. So this joint here between calcaneus and cuboid is calcaneocuboidal joint, which is a saddle type of variety, right? So after this, the next important thing is the spring ligaments, right? The next important thing is the spring ligaments. So what was the spring ligament in case of medial longitudinal arch? We already discussed. So where is the spring ligament here? So this is a spring ligament. This is called as calcaneonavicular ligament, right? So calcaneonavicular ligament is a spring ligament over here. Calcaneonavicular ligament. Now when it comes to the lateral one, what will be the spring ligament here? This spring ligament here will be 2. One is called a short plantar ligament, long plantar ligament. These two will be called as the spring ligaments, right? So short plantar and long plantar ligament. Short plantar ligament and long plantar ligament. So these two will be the spring ligaments over here, right? So apart from this, the next important thing I want to discuss is that, so these are the differences here: medial longitudinal, lateral longitudinal. You know what is anterior pillar having, right? So this is the anterior pillar of medial longitudinal, head of 1 to 3 metatarsals, head of 4 and 5 is that. The posterior pillar is medial tubercle of calcaneum, there it will be lateral tubercle. Here the number of bones are 9, there are 4. Here summit matlab the keystone bone, that is your talus, and here it is cuboid, right? And next important thing here is the joint whatever you have. The joint whatever you have here is the ball and socket joint, that is your calcaneonavicular joint, and there in lateral longitudinal you have got calcaneocuboidal joint, which is a saddle joint. Hai? So spring, the spring ligaments are calcaneonavicular. Here it is short and long plantar ligaments. Now regarding the clinical points, what are the important clinical points which you can see? So regarding the clinicals are very important. Right, so you can see this foot is completely flat, right? So such presentation you call it as a flat foot. Okay, so flat foot is also called as pes planus. Pes in the sense foot, planus in the sense plane. So pes planus is nothing but your flat foot, right? Now after this, the second important thing is this foot, if you see, you can see an arch, but this arch is very high, right? So such kind of foot is called as high arched foot. High arched foot. Such foot is called as high arched foot, and this is called as pes cavus. Why it is called cavus? Because it is like a cave over here, right? So this looks like a cave. So this is called as pes cavus or high arched foot. And after that, you can see this condition. This is called as club foot. This is called as club foot, where the patient will be walking on the toes, right? His heel will not rest the floor, but his toes, he will be walking on the toes. So that is why this club foot is also called as talipus equinus. Talipus equinus, not equivarus. Equivarus is different. So this is talipus equinus. Okay. Next important thing, the opposite. If someone is walking on the toes, that is talipus equinus. The opposite is the heel. If someone is walking on the heel, that is the calcaneus bone. This is called as talipus calcaneus. Okay. So this one over here is your talipus calcaneus. This is your talipus calcaneus. Next, in this, both the foot are inverted inside, right? So this is called as talipus varus. Talipus varus. Talipus varus is also called as your inverted foot. Inverted foot. And next here, the foot are everted. The opposite of talipus varus is valgus, right? So this will be talipus valgus, which is also called as everted foot. Everted foot, right? And lastly here we have got this condition, where this condition is called as talipus equinovarus. Talipus equinovarus. Now what is this talipus equinovarus? Is that the first thing, foot is inverted or everted? It is inverted. Foot is abducted or adducted? Foot is obviously looking towards the body, so this is adducted. And second important thing is that look at the plantar region. The plantar region is extended like this or flexed like this? It is flexed like this. So what are the three things you can see over here? First thing, you can see that the foot is inverted. Foot is inverted. Foot is adducted, right? And next important thing is it is plantar flexed. Plantar flexed. These are the three important things which you can see. Next important thing over here which you can see. Next important thing which you can see here is that there is a problem with the great toe. So this is called as hallucis, and the great toe is looking laterally. See, this is the lateral, this is the medial. Great toe is towards the lateral side. So hallucis valgus. This is called as hallus valgus. In this hallus valgus, what is happening? The toe is deviated laterally. Toe is deviated what? Laterally. So as the toe is deviated laterally, that will lead to formation of a swelling here near the joint, right? Now this swelling is called as bunion. Okay, so that would lead to bunion formation. That will lead to bunion formation. This is nothing but called as your adventitious bursa. This is nothing but called as your adventitious bursa. So where is this bunion formed? This bunion is formed medially.